am. I'll be your CNA today. Excuse me while I wash my hands. May I see your name, Dan? Okay, Miss May, today I'm going to help you help clean your catheter, so let me get my equipment. My equipment is going to be 2 chucks. What's the difference between that and pericare?
3 chucks.
I have 3 chucks that you bring. For pericare, the person is on a chuck that is wet. Here, they're not on any chuck. They have a catheter in, you're going to clean the catheter. I'm going to bring a second chuck that I'm going to put them on so the bed does not get wet while I'm giving them catheter care. I need a towel and I need a bath blanket. So the bath blanket is for what?
The one to dry.
What do we use the bath blanket for?
To cover their...
Yeah, for privacy and warmth, okay? Basin, soap. How many washcloths in this one? 2. One for washing, one for rinsing. So you're going to work in pairs again. One person is, it's like at home doing the dishes. One washes, one dries. Here, one washes, one rinses, okay? And then you dry. Okay? I need my gloves. I'm going to lock my wheels, raise the bed to working height, and here we're without any barrier. The temperature of the water is what? 105. If you put some water in the basin, it's a little bit better practice because you know you have to wet the washcloth before you wash the person, and you're not going to use a wet washcloth. The soap should never be left in the basin. The washcloth shouldn't be floating around in the basement. You wring your washcloth. If you're not using it, you put it on the side or put it on the side of the basin. And you don't want to have it dripping onto the floor because that can cause what? An accident. So you want to make sure that the towel is wrung out and on the side of the basin if you leave it there. Okay. So now I'm going to put on my gloves. What are you doing there? Catheter care. Oh. So while people are practicing, you're going to do the review book. After this finishes, we're going to watch videos. That will work too well. I'm going to ask the person to turn on their side, cross their legs, cross their arms on the count of 1, 2, 3. I'm going to put them on the chuck. So it's going to be rolled towards me, midline. And move the nightgown out of the way. Remember, the chuck doesn't go the long way, it goes across. And Miss May, I'm just going to ask you to turn a little bit towards me. So now I'm going to use the bath blanket. How does the opening go?
Long.
It goes to the top part of the chest, towards the face. I hold it up, and 1, 2, 3, it goes down. The person is covered.
That should be disinfected.
Huh? I know, you're right, you're right, you're right. And you can use, they usually have some spray or something in the room that is a disinfectant. Alcohol works well. I used to put alcohol on a washcloth and just clean everything in my, before I started working. Even the patient's basin, I would kind of just give it a once over with alcohol after I rinsed it out. Okay, so she's covered. Where's my second washcloth? Here. Okay. I'm going to bend the leg that's furthest away first. Why?
Support.
No, because if the person's very tall, then I have to go around. Okay, it just makes sense. That's further away. Now it's not going to be in my way. Her joints are getting worse day by day. I wet the washcloth. I wring it. I soak the whole washcloth, right? Not a lot. I make a mitt on the hand that's closest to the foot. I uncover one part here. This is what I'm doing. I go under the leg and I'm going semicircle to the urinary, the insertion site of the urinary meatus. So here, just where the tube is, I'm just cleaning that area gently. This is a very thick washcloth and most hospitals don't have this, they have thinner ones. I move it out of the way and I'm cleaning very gently, semicircle. So that's cleaning the insertion site to the urinary meatus and also cleaning the upper part of the catheter. So I flip it and I hold it and I make an indentation. I'm going to support the catheter here with my fingers and I'm either going to go underhand or overhand, whatever is easiest. And now I'm going to wipe the catheter 3 to 4 inches down. Why am I supporting the catheter? So it doesn't pull on the person. That's inside the bladder. After I do that, I have this panel of the washcloth and this panel of the washcloth. That's all. You move the washcloth out of the way and you go down 3 to 4 inches. You move it out of the way and you go down 3 to 4 inches. You just go down the sides of the labia, okay? So
and then you rinse the same way?
And you rinse the same way, same thing. So it's this, one corner, other corner, semicircle, semicircle. You flip it. You make an indentation. So the catheter can very easily be cleaned that way. You hold the catheter, you go down 3 to 4 inches. Now you have this part that you're going to open and this that you're going to flip around. And you're going to go down on one side of the labia, you go down the other side of the labia. In many institutions they now have towelettes and solutions that they use, so don't be surprised by that. But if you're washing someone and it's still an effective way to clean somebody, the solutions don't work too well if there's other contaminants. So this works well. And then you pat dry. Okay, this can go into the hamper right away. I cover, I lower the legs, I'm going to turn the person on their side, roll the chuck away from me, lift the person towards me a little bit, and bring the chuck down. It goes into the trash. I cover the person. And I bring down the towel. And these
Would you do it with the gloves on still? You would do
Yeah.
everything with the gloves
Yeah.
on? Okay. Okay, I'm just
Yeah.
asking what you're
Yeah.
looking for.
Yeah. So you would have used this as to dry. All this goes off. The person is just covered. You're not going to fuss with them. You're going to empty the water. Cold, hot. Disinfectant. You would clean it out. Close the water. Dry the outside. Dry the inside. The soap goes in here. You open up your drawer. And you put it away. What happens next?
Remove your
Then
gloves.
Yeah, all this gets thrown out. I remove my gloves. 2 fingers. Wash my hands. Then I come back and I neaten up the patient. Some examiners are very short. They don't have much patience. Some are. So some people
I wish I
with
find one of those that doesn't have
patience, yeah, that has patience.
That doesn't have that much patience.
Why?
Because then they'll do it faster.
No, they get on your nerves. That's not so. Okay. You give the call bell, and you reach it, you lock your wheels, you lower the bed, you unscreen, you wash your hands, and you exit the room. So, which is a simpler skill. This one, because you don't have to turn the person, oh, I'm sorry? Yeah, I got them off the chuck. I do it so automatically, I don't even realize it. So she's off the chuck.
Do we have always to check the position from...
Not for the state board, not for the state board. But anytime you're working with a patient, you're gonna make sure they're in alignment. If the person is like this, what, am I gonna ignore it because it's not positioning? No, you're gonna position the person, and you're always leaving the person in alignment. Because what can that affect? If the person's not in good body alignment, what happened to you?
Late. I was trying to cash a check. It take a long time.
Okay. So sign in late. It's 10 to 1. 10 to 1. 12:30 was when you were supposed to be back.
I'm late.
Yeah.
Yeah, you gotta pay.